Dr. Nisha Malik, Assistant Professor from the Department of Physiotherapy, RPIIT Karnal. Welcome to our YouTube channel, which is RPIIT Academics. If you like the content of our videos, please like, subscribe, and share our channel. So, we're going to talk about what are the types of suspension therapy. First is axial suspension, second vertical, and third is pendular suspension. So in axial suspension, the joint axis is assumed as the pinpoint of the suspension. The slings beyond the axis of the joint to support the extremity. If the activity is started, the extremity is dragged on each side. The components move parallel to the ground. Then uses of suspension therapy, axial suspension therapy. First is for relaxation, then sustain muscular property to boost the blood circulation, to improve the venous drainage, and to improve the lymphatic drainage. Then what is vertical suspension? The center of gravity of the body is assumed as a point of suspension, operated to deliver reinforcement to the body region of the patients. Uses of vertical suspension is to sustain the body portion, to decrease the pressure sore. Then pendular suspension. The point of suspension should be moved out for the joint axis. Activity generally bring place against gravity. Muscle will be obtaining resistance during movement if the axis is moved to oppose that motion. Then uses of pendular suspension to strengthen the muscle, to raise the muscle power and to improve the endurance. And advantages of suspension therapy and disadvantage of suspension therapy. Then advantages is it lessen the load on the therapist, comfortable lifting the extremity, active motion can be accomplished effortlessly with the lowest friction, more comfortable to carry the position of extremity with slings and pulley in the needed position. Then disadvantage advantage, especially complex and not always the first option for beginners resistance exercises. Needed a lot of material, for example, sling, ropes, and pulleys. Then technique of suspension therapy for shoulder abduction and adduction muscle name. Then abductor muscles is 0 to 15 degree, supraspinatus 15 to 90 degree, middle deltoid 90 to 180 degree, trapezius and serratus anterior. Adductor pectoralis major, latissimus dorsi and teres major. Then position of the patient, supine lying position. Point of suspension 1 inch below the acromion process of the scapula. Then accessories required as Suk 3 ring sling 1, single sling 1, supporting rope with the wooden clit 2. Procedure 1 inch below the acromion process of scapula is assumed as the suspension point by the primary supportive rope, which is secured by the S hook with the suspension frame. A secondary supporting rope is connected in the same S hook. 3 ring sling is operated to sustain the wrist. A single sling is operated to reinforce the elbow. The primary supporting rope is connected to the wrist sling. A secondary supporting rope is connected to the elbow sling. The patient is recommended to execute the abduction activity of the shoulder. For intensifying the abductor, medial motion of the axis is taken out and vice versa for adductor identifying. So इस पिक्चर में दिखाया है सस्पेंशन फ्रेम को.